Great to be joined by Hilton Head Fire and Rescue EMS Battalion Chief Tom Bouthillet. Tom, thanks for joining us on WHHI. We're usually thinking about you guys and fires, but as we mentioned, you're the EMS chief, and this is something that happens a whole lot more often. We're talking sudden cardiac arrest. How is that different from a heart attack?
So that's a great question. Let's start with heart attack.
Yep.
So the heart is a muscle, and so like any other living tissue, it requires its own blood supply. So the heart actually pumps blood to itself through three main arteries that we call the coronary arteries. And through a disease process called atherosclerosis, you can actually develop a blood clot right inside one of your coronary arteries. And when that happens, the blood vessel becomes occluded, and it starts to deprive the heart muscle of oxygen and nutrients. And so for most patients, that's painful, and they develop chest pain. And left untreated, part of the heart can actually start to die. So that's an acute myocardial infarction, or what we call a heart attack.
Right.
Sudden cardiac arrest is a different disease state. It's a little bit related because a heart attack can cause sudden cardiac arrest, but that's not always the cause. A patient in cardiac arrest, their heart is actually stopped, and they require CPR, and in many cases they require defibrillation or a shock to restart the heart. So they are different diseases and they require different therapies.
All right. Good news is Hilton Head Island's a pretty good place to have this happen, isn't it? If
Well,
it has to happen.
If you must have a heart attack or sudden cardiac arrest, there are much worse places than Hilton Head Island to have one. We've been working at this for a very long time, and we're quite good at treating these very time-sensitive medical emergencies.
Great save rate?
Actually, we have one of the highest save rates in the United States.
That's great.
So, for example, last year, there were 16 patients who met a very specific and important criteria according to the academic template we use to measure cardiac arrest survival, meaning someone witnessed the collapse. That's very important because if you come home from work or something and find your loved one on the floor, their odds of survival are extremely low. So in those situations where someone observes the collapse, and the first heart rhythm is something that we can shock, that goes into a special category. So that happened on Hilton Head 16 times last year, and 11 of those 16 patients survived all the way through to hospital discharge with good functional capacity, which put our save rate at about 68% for that type of patient, which is indeed one of the highest in the United States.
That's terrific.
Yeah.
Three important letters. We don't have a lot of time, but let's talk about CPR. How can folks get involved and learn CPR so that they can keep this from happening?
Right, so they can contact our fire and life safety educator, Cinda Seaman, at 843-682-5141. If they would like to learn CPR. And the good news is, though, if you're the 911 caller, our dispatchers are specially trained to talk you through, even if it's hands-only CPR.
Okay.
So some CPR is better than no CPR.
Absolutely.
That's right.
Tom, thanks for the primer. We'll get into this in more depth some other time soon. Tom Bouthillet of the Hilton Head Fire and Rescue Department.